Hi everybody, Dr. Dranjanabhana here, and welcome back to my YouTube channel. So today it's this or that, but it doesn't actually have to always be this or that. It can be this and that. But people always want to know the difference. What is the difference? What would be best for them? What should they do? And of course, I can't answer these questions here. It's important to come in and go see your aesthetic doctor or practitioner face to face and have a consultation, medical history, and discuss what's important to you. But there's a confusion about what each thing is, because we are bombarded with loads and loads of information, lots of videos, lots of, you can Google like what's the difference and this versus this. I'm sure there's lots of articles on it, but just explaining what they are. So this is a biostimulator, a pure biostimulator as they call it. And it's made out of powdered polylactic acid. So this is the OG biostimulator. There's a couple more on the market at the moment. This one here in particular, I know it's been around for over 20 years, about 250 studies on it, and I feel very, very confident to use it. And what it does is, it doesn't fill, it doesn't volumize, but it is treating laxity. So not extreme laxity that you'd need a facelift for, but it does provide improvement in a little bit of tightening, plumping the skin, and the biostimulation works with inflammation. So extreme biostimulation, bringing in new blood vessels, new fibroblasts, more collagen production, elastin, hyaluronic acid, and then improving the quality of skin. So I like using it also, in the temple area. You can go all the way back there, even get over, but this is the catch with this biostimulator, is the time and the sessions that you have to do it. So people say the friend of this polylactic acid, is time, and you don't see an immediate difference. It takes months. And in the next year, after multiple treatments, depending on your skin quality, depending on your age, in the next year, you see an amazing and beautiful result, but it's just the waiting for that result. It's generally applied in the lateral part of the face, although in the States it's popular. They inject it on the periosteum, but there's no osteoblast that create bone, but it is injected on the periosteum there. They often go also into the mid-face, but never around the mouth or around the eyes, very hypermobile areas because of nodule formation. So if you want a natural look, you're not keen on fillers, this might be a good option for you for intense stimulation. But then the other one is also a biostimulator, but it's calcium hydroxyapatite. So yeah, it's a biostimulator. That's its side gig, although it does well with it, but it is classified as a dermal filler. So volumizing primarily, especially in its normal undilute form. Both these products were developed for lipodystrophy that came with HIV. So that's where it was, replacing volume and laxity with that. But now it's used for aesthetic purposes, and this can also be used in the hands. Both of these, incidentally, like this is the famous Brazilian butt lift product. This is actually originally from Brazil, and this also they use in that area. So are very versatile, and both of them treat skin quality. So both for acne scarring, stretch marks, although this has an immediate result. So you see the volume, one-to-one volume improvement immediately. The biostimulation also still takes a bit of time. Same with that, and it's not much with inflammation, but more like a biomechanical action. So how do you know? Like a lot of our patients, but the time between these two treatments, we keep it at a safe time and in different areas. But a lot of our patients have done both. But some people wonder what is better for them. So if they they're looking for an immediate difference, they have an event in a month or two, they want volume restoration, this is something to consider. If they've done many treatments, they're in it for the very long game, and they don't mind waiting for result, this might be something to consider. But it's important to go for consultation and see what is best for you. And also, they don't last forever. None of these things last forever. There is a patient-like satisfaction studies, you know, this one I think is about 25 months and this is 15 months, and often around that time people feel like, you know what, I need to maybe go maintain my treatments. But if you have any questions about anything, actually anything aesthetic besides these two, you can drop them in the comments down below. Like, share and subscribe. Bye.